Hemorrhage has been the leading cause, accounting for nearly 40% of deaths. Limited access to quality and affordable maternal health care has worsened the crisis. Now, in an unprecedented move, the Kenya Obstetrical and Gynecological Society and the Kenya Pediatric Association are partnering with religious leaders to raise awareness and curb maternal deaths. Anastasia Mukabi has more.
For years, maternal mortality rate has stagnated at an estimate of around 355 deaths per 100,000 live births, the leading indirect cause to these deaths being postpartum hemorrhage, accounting to 35 to 40%, the contributing factors being cultural practices and beliefs that pose a significant hurdle to curb the maternal morbidity.
Lack of awareness that these mothers need to come to hospital to be assessed every month or every 2 months for that matter. Because according to WHO, we need to see these mothers at least 8 times. Most of them come once or none at all.
To reduce this maternal mortality to 40%, Kenya Obstetrical Gynecological Society and pediatricians held a meeting with religious leaders to enlighten them on the need for the religion to play a role in sensitizing the community on the need of expectant mothers to take maternal health seriously to reduce incidents of PPH.
If we can have a declaration, and on this I can put my word to it, and can convince these religious leaders that for the next 3 months we make a decision that in our sermons we talk about maternal, newborn, child, adolescent health.
So having that message percolated to the congregants so that awareness is the first step for everybody.
Kenya's maternal mortality ratio compared to other countries is alarming. Therefore, doctors with the help of technology are trying to adapt successful programs from other countries to curb the PPH rates, calling on the Ministry of Health to improve on data collection to better track maternal mortality trends as well as identifying areas for improvement.
Means you do not have to necessarily donate blood when it's not needed at that particular place. So this is basically deploying technology, deploying our knowledge of our blood groups to be able to donate blood for the need that's there at that particular time. And we really hope that we can be able to work with the Ministry of Health that's very supportive and the other stakeholders to make this concept work in this country.
The reduction of funding from the United States of America to African countries requires the government to invest more into healthcare system and research to address this issue, as 50% survival of the baby is heavily dependent on the mother's survival after birth.
We are asking the government, national government, to put in the funds, equip delivery rooms, because the guest is coming and they are coming every time, any hour. So we have to be ready at all times to receive them.
The goal to zero mortality starts with access to quality health care, addressing postpartum hemorrhage, regular prenatal and postnatal to identify and manage complications, empowering women through education, tackling socio-economic factors like poverty and malnutrition, and implementing research and technological strategies to improve maternal health services. Anastasia Mukabi, TV 47, Nairobi.